Staying with us, it's time now to address some more conventional health questions this week. Joining me now is News Channel 5's medical specialist, Dr. David Soria. He is the chief of emergency medicine at Wellington Regional Medical Center when he's not spending time here with us. Thanks for coming in.
You're welcome. Good to see you.
Good to see you. So we're getting back to basics today. Our first question for you today, pretty common health problem. How do you treat canker sores, and is there a way to prevent them?
Yeah, well, if you've ever had one of those and then had some salty food, I mean, you'd see stars. I mean, it's very, very painful. However, equally benign. Doesn't really cause much in the way of problems. We don't really know the cause, though. We think maybe it's viral, maybe it's from tissue injury. There's certain foods that can trigger it, like high acidic or citrus-based foods.
Okay.
But really, we don't really know. So the treatment, really, it goes away in about a week regardless of what you do, so many times it doesn't require treatment. But if it's exceptionally large, or if you have multiple, there is a solution that we can prescribe that has a steroid in it, Benadryl or any other antihistamine, as well as a topical anesthetic. You swish that around, it helps relieve the symptoms.
You actually put it on, like
you put
lotion.
it on, you swish it around, you got it.
Okay.
And then it actually helps relieve some of the symptoms and maybe even decrease the duration of the lesions.
Okay, but really just time. Just let it heal.
About a week, it's going to go away no matter what.
All right. Our next question for you today, especially relevant here in South Florida. How often should you get your skin checked out?
Yeah, I mean, a lot of people blow off skin examinations. Not something that we typically think about, but just to put things into perspective, I mean, skin cancer is 5 times more prevalent than prostate or breast CA, and there's over 1 million cases diagnosed every year. And even more important, 95% of those are treatable if they're picked up early. So that should be enough of an incentive right there. You're high risk if you've had it before, if you have a family history of skin cancer, or if your lesions or moles are irregular, or if you have multiple of them, meaning 20, 30, 40 or more.
Okay.
What you check for, remember the A, B, C, D, E of skin examinations. A for asymmetry, it doesn't look the same on both sides. B for border irregularity. C, color change. If each exam you see a difference in the color, that could be an indication that there might be a problem going on. Diameter, the larger or wider, the more chances it has of being cancer. And then evolution, E for evolves. It changes over time. Any of those, it's important. And that's important to remember if you're self-examining. Of course, your doctor, every time he or she sees you, will do the same. How often? No more than every 3 months is my recommendation, because if you check too often, you're not going to be able to notice the subtle changes. Right. So don't check it, don't look at it, but every 2 or 3 months, and then you'll be able to see some of those subtle changes.
When you go in for your annual physical, why not?
Right.
Why not?
Absolutely.
Can't
it's
hurt.
important. It's important.
Yeah.
And if your doctor isn't in the habit of doing it, remind him or her, please.
Okay. And our final question for you today, kidney stones. How do you stop them from forming? Can you?
Well, you know what? Kidney stones are very common down here for a number of reasons. But kidney stones are sort of like diabetes. If you've been dealt that card at birth, you're going to form stones no matter what you do, and there's really nothing you can do to stop them. But there are some things that we can do that might decrease the incidence. First and foremost, drink plenty of water. Down here, dehydration is probably the single most important cause, or certainly contribution to forming kidney stones. Also, exercising, because what that does is it keeps blood flow and your kidneys working, and it helps basically eliminate some of the sediment that could sit there in the kidney and cause that stone. As far as what things to avoid eating, animal proteins or meat absolutely has been shown to increase the incidence by about 10 times. So if you're a kidney stone former, try to avoid that. Also, certain fruit juices as well as cola. What things have been shown to help? Believe it or not, lemonade. More lemonade actually helps decrease the incidence. You bet. And then foods with potassium are also beneficial.
All right.
So.
Learn something new every week with Dr. David Soria. 3 great questions, 3 great answers. If you've got a question for him, you can write him right from our website, WPTV.com. Thanks for coming in.
You bet.
We'll be right back.